Welcome back to Talk the Doc. I'm Dr. Oyi Balburias with Ms. Chiki Roa Puno, of course.
Yes, and to enlighten us on our topic, which is autism, is Dr. Lourdes Sumpayco Tanchanco. She's a developmental and behavioral pediatrician at the Medical City. Doctora, thanks for joining us.
Thanks for inviting me.
Okay.
Good evening.
Yes, start na. Okay, first question, TP. What do you think is the reason why there is an increased awareness regarding autism in our country especially?
Okay, well, it's a buzzword these days, diba? So you see it in print media, you see parents talking about it in their blogs, in the internet, so it's everywhere.
Yes.
Maybe another factor is that society is more open to having children with disabilities, so they're easily identified even in schools. When these young children enter school, then the teachers are also part of the advocates who pick up the symptoms and refer accordingly.
And you know, you're so right. It's really the awareness. And I think yun din eh. There was a time na nahihiya ang tao if there seems to be something wrong, hindi ilalabas ng bahay. Ngayon, I think parents are more willing to find out really what's wrong.
Correct.
Diba?
We're getting there.
We're getting
Kasi
there.
syempre there are stages pa rin na may denial pa rin, ganon. Sometimes that delays the diagnosis. But once there's that openness, and that's yung openness to partnership with health professionals, then that's the time when progress is made in the management of these children.
We want a peg of, kahit na, let's say worldwide, how prevalent is autism?
The latest data from the Center of Disease Control is that there's a prevalence of 1:91 individuals. So medyo
Very
common.
Medyo
siya,
common.
Parang 10%.
Oh, that's not
parang
that's not
ganon, diba?
exclusive to the Philippines. That's a
It's
picture
not.
in the world.
Correct.
Yeah.
We don't have local data yet. So,
Is that more or less than, let's say, 10 years ago?
yes. You know, when I was in training, the prevalence that they gave us was 1 in 1,000. In
talagang-
5 years' time, di pa ako ganun katanda. Pero in 5 years' time, biglang 1 in 250. And then ngayon,
1
yung
is to 91.
data last year, it's less than 100 na. So 1 is to 91.
So factors are both, you say, genetics and the social or environmental
Yes.
factors that contribute. So what do you think will the parents be watching out for, like red flags for symptoms or signs for their children to suspect that possibly autism is present in their child?
Right. After the first year of life, diba, crowning glory of the first year is walking. But after that time, they begin to notice speech and communication skills. So usually in children with autism, there's a delay in the development of language skills. So that's the first thing that they usually observe. But oftentimes, you will also observe these young children who seem to be living in the world of their own. So even if you call them several times, they don't turn to you, they don't play with other children, they prefer being alone. Or for some kids, you see them having ritualistic behavior.
Paulit-ulit.
Lining up of toys, spinning of wheels, patay sindi na ilaw. So sometimes you see those in very young kids.
I think you have to also depend on your instincts. Kasi yung speech delay, pwede rin naman na mabagal lang. Di ba sabi nga din, mga lalaki, mas mabagal matuto sa... It could be those things, but then I think, ay, di ba? Sabi nila, hindi pala ako. Hindi, humahabol naman kayo, Doc. Hindi, pero I think it's also something that you might feel na if there's something really you think is wrong.
Correct.
And I think the best thing is to really just see the specialist na to rule it out if you're not sure. Kasi pwede rin may hearing defect, di ba?
Correct.
Pero, sige, sabihin na natin kutob ko, parang something's wrong. What do I do next, Doc? I go look for a specialist. What kind of doctor do I look for?
Actually, the first person who these parents encounter are the general pediatricians or the family practitioners. And right now, more and more, these doctors are also being trained to be on the lookout for what we call the red flags. Okay, so they screen their patients, ideally, because sometimes they're too busy din, diba? Yung ang dami nilang tinitreat, cough, colds. But part of that consult with the general pediatrician should be developmental surveillance and screening.
Okay.
Yeah.
So once you have that, like the patient was referred to you already and you finalize the diagnosis already. So how do you advise the parents about this? Of course, sometimes it may be a shock to them, right?
Correct. I guess it's that basic respect for parents, yung to understand where they're coming from. Kasi sometimes you can't bombard them with facts during that visit where you give the final diagnosis, diba? But the thing is, you need to reassure them that you will be walking with them through their journey because it's going to be a tough one. You will need therapy, you will need special teachers, and it's important that communication is very good between all the professionals, kasi it's not just one professional who's handling this child. Okay, so you build a network for the
It's a
family.
team talaga, no?
Team talaga. It's a
Right.
multidisciplinary team.
In the case of Matt, he was diagnosed to have mild autism. As I understand it, it's a spectrum.
Yes.
There's some you say there's a mild or more severe type of autism.
Right. Actually, we don't usually put them in categories of
Okay.
mild, moderate, and severe.
Okay.
But because autism is a spectrum, you will see the whole gamut of symptoms, diba? And you don't see them in just one individual.
Okay.
For the very severe, these are usually the individuals with the lower IQ.
Okay.
Kasi the prognosis, the long-term outcome is still dependent on the IQ of the child. They say that's the best gauge for later outcomes. So for those kids naman who are able to receive intervention very early and those who have higher IQs, then they're the ones who can be put into regular school. They're integrated well into communities. So that's our goal for all of these children.
Okay. So once you've set parang you've put together a treatment plan, let's say, how do you know if it's correct? What kind of, what are the things that you look out for, the signs that they are improving?
That's a good question, ha? Kasi, well, when you treat autism, it's not a one-size-fits-all. It's not RTW, diba? Kailangan tailor-fit talaga to the individual. So that's the reason why we really need to see them and monitor them periodically. That's our role as developmental pediatricians. And then, what we do is we base it on what we perceive as their needs. So together with their team, ideally we meet with the team. So if there are occupational therapists or speech therapists or special educators involved, we really sit down with them as doctors. We sit down with them and we sit down with the family. Because when you come up with goals for these children, yung family's needs are important, diba? So you have to prioritize the things that the family will think is important for these children.
Kasali talaga ang parents sa team, no? Even
Yes.
siblings ba,
Correct.
Doktora? Yeah.
Correct. Kasi partners mo sila. They're the ones who are with this child 24/7. You only see them once every 6 months. Diba? Pero sila yung day in and day out kasama nung child. So halimbawa, they don't watch movies pala. So hindi mo ini-include dun sa goals na you're going to come up with. Diba? So yun, that partnership is very important.
And then, I guess you also have to caution parents to be realistic also, because sometimes they might want an objective that you know that they cannot attain, di ba?
Correct.
Nagkaroon na ba kayo na experiences na ganyan?
Madami.
Oo.
Madami. Pero it's like this. We want to be as objective as possible when we evaluate children. Kasi we don't want to give false expectations for parents, kasi that's where the disappointment comes in. Diba? Pero syempre, you always give that ray of hope whenever you see these patients. Kasi sometimes these children can surprise you. Kala mo hindi magsasalita, tapos the next visit, oh, and
Oh, yun naman, on the upside, bigla
Diba?
na lang kung ano yung hindi mo
Merong
akalang
ganon.
kaya.
And that's the value of early intervention. Diba? If you intervene early, the brain is very malleable. It's very plastic pa. So you can do a lot of things with it. But the clue there is, yun nga, aggressive din dapat yung parents when they intervene for their kids. Kasi sometimes you don't, as parents, we listen to the parents kasi, because studies are showing us that the parents' observations are very accurate. Diba? Kasi yun, siguro kutob. Tawag natin kutob. Pero sa literature, wala silang word for that. Diba? Pero malakas yung kutob ng parents if there's something amiss with the development of their children. So as health professionals, we really need to listen to them, to pay attention and address their concerns. So I guess yun nga, yung partnership na yun is very important.
So many things I'm learning already. Dami pa niyan. We have more time with the
But we'll have a break.
Yeah.
Okay. So coming up after the break, we'll talk more about autism. Plus, of course, we'll also take questions from our studio audience and our televiewers.
All right, keep it here. Talk to Doc. We'll be right back.